looking at the global field, clearly there's something that's happening in Ireland and Scotland, and I'd like to turn to you, Prof, and just ask, globally, have other countries had public health concerns with counterfeit alcohol? And can you maybe give us some examples? Because we're hearing that people are like, cigarettes, maybe yes, because I can see the impact immediately, but alcohol, not so much, because if it's cheaper and it still gives me a buzz, why change, you know? What are you noticing globally from a health perspective?
That's a very interesting question. And I mean, those that do a lot of reading and all of that will find a lot of this in the literature. And every so often, not only do we find it in South Africa, we have instances of, I'll use the word alcohol poisoning for now, but a lot of it has also been instances of adulteration with methanol and other compounds. So yes, to answer your question, there have been fatalities due to consumption of adulterated alcohol or alcohol poisoning all over the world. So it's a global problem. And I think that we cannot emphasize that more. It is a global problem, and we have to work with it collectively if we want to have an effective strategy to eradicate this. So 2 countries that come to mind, where I'm mentioning them because it has happened, I think, more than once. The one is Russia, and the other one is India, where there have been fatalities and hospital cases. Just to be more specific, in Russia, okay, people are going to ask, like, why did we pick these 2 countries? But I don't want to give any particular reason as to whether it's the socioeconomic, the availability, the rules, and all of that. But the reasons are usually multifaceted. And the one that pops up is in 2021 in particular, there were over 100 deaths reported in the literature and also in MSM, mainstream media. And in particular, in the Orenburg region, 34 people died from consuming illicit alcohol laced with methanol. So once again, the terminology that I'm using is illicit alcohol at this stage, because that's how they reported it. In addition, hundreds of people were hospitalized. So it was there was a public outcry. And in India, what fascinated me is that they particularly mentioned that this illicit alcohol that was consumed that led to deaths and hospitalization was laced with methanol. And it happened in the Assam region and Uttar Pradesh. So what really struck me is the Assam region, because if most of you all have read, it's very well known for its tea. And it was these workers on the plantation that after a long, hard day's work of, working in the fields, they consumed the alcohol and they rapidly fell ill. Over 150 people died. In the Assam region, over 100 died. And this was, I think, in 2019, if I'm not mistaken. Yeah. So others also suffered blindness and organ failure. I think the important message here is that, yes, you can have blindness, you can have organ failure, but you could die. So it's really, really important how we pitch our education towards this. And having more empirical research for me into this kind of thing and highlighting it to the people will obviously go a long way in eradicating the problem. But I think, as you mentioned, the education through maybe journal articles and research and all of that is the way to go, because people don't really know what is going on. And it's not only methanol that's found as an adulterant. There are other compounds, which I'll mention later.
And Cleo, from your point of view, what are your thoughts?
Thank you so much. And thanks to the gentleman as well for sharing. And thanks, Prof, also. I just wanted to bring in, from the Department of Health's point of view, one hospital in particular, I won't name it, has spent over 12 million on just alcohol-related illnesses. And the more I listen to Prof, already I'm able to dot some of the what the challenges could be. But yes, the emphasis has been on the organs in particular. But I'm just basically saying, as a country, this is one of the things that we are impacted in, basically. It's not just in terms of employment, it's not just in terms of the other things, but financially as well, we are feeling a pinch. And just to confirm what the gentleman was saying, that they don't care. You know, someone would be at the hospital this particular time for this, and they would do whatever procedures to reverse all those things. And guess what? In a month, they are back there. So literally the money that we're even spending in terms of providing health, services to some of the individuals, it's just going to waste because we're not getting any return on investment. But instead, they are now perpetual patients, so to speak.